So I'm going to take a step through a few different views and options that comes with this Canopy product, but we're going to start off just kicking it off with just a nurse call event, which is where it's going to start. So what we're showing here right now is basically a nurse console view that could be at the unit level or in a centralized command center model, where this is a central command center where they can triage all of the calls throughout a facility or organization. Across multiple hardware platforms. So I'm going to initiate a patient call, and in this case it's just a pillow call is coming from a patient room, and this can also be like it is here. I got a Rauland system sitting right next door in my room next to me, and so I have a little demo there that's connected to the system, so I can show a Rauland nurse call event coming in, and then what I would do is touch or click on to answer that call, and this is where we're going to start. So we give you a lot of information here when you see this call event come in. So I know the location, but more importantly, I know the patient. And this is where we kind of change the methodology a little bit. It starts with properly triaging and assessing this patient's need, and that starts with proper communication. So typically with nurse call systems today, they would just answer the call saying, "Yes, can I help you?" And the patient just always wants their nurse because it's a voice in the room. They don't know who they're talking to, so they want to talk to somebody they feel comfortable with, which is usually a nurse. So we change that by saying, "Miss Hertz, this is Shane. How can I help you?" "Oh, hi, Shane. Yeah, I need some help going to the bathroom." "Oh, okay, no problem." And I can hover to see who the assigned staff is, so I know who is working with this patient, and I can say, "Hey, it looks like Kamal's your nurse today. I'll go ahead and let her know." So it starts out with that, more of a hospitality approach rather than a hospital. So it's more of a concierge service. And that gives us a lot more detail from that patient, which is going to help us when we start this whole process of notification. So we can then layer on top of that, right? So we're going to give them new software, new look, new standardization, workflow management, the awesome analytics that Courtney has mentioned, and then device notification as necessary based on what they want to go to. So it's one common platform. So we're enhancing that overall patient experience with that legacy hardware. So the hardware still stays. If there's nothing wrong with it, we can keep it. Let's keep it another 5, 10, 15 more years. Now, if the hardware is failing, that's another issue. And as Courtney pointed out, that's where we can come in and start displacing the equipment as needed. But in this case, I'm just utilizing that legacy Rauland 4 nurse call hardware and adding some additional features to that. So with giving that information here, I can have a lot of details about this patient, including fall risk, which is important when I'm communicating with that patient to make sure I say, "Miss Hertz, do me a favor, don't get out of bed. I got Hamal's on her way, and she's going to take care of that for you." Down the center here, we have our unit-specific request. So these are going to be customized based on an individual area of care. So an LDR, maternity, pediatrics, ED, they all have different types of request. Rather than just a standard nurse needed, which we see so common today, the 3 typical buttons they might have, nurse needed, LPN needed, aide needed, we're enhancing that again and taking into in greater detail. And what's nice is there might be a lot of information here, but I can start just typing it in. It's going to narrow that list down. So if this patient is requesting pain medication, I can go ahead and just simply type it, narrow it down. I've selected that, and I'm going to go ahead and send that notification out. Now what's going to happen is a couple of different things. So one, we want to get that notification that's going to go out to a mobile communication platform. And here we're using the Critical Alert CommonPath Connect application. And this is residing right now on a Versity phone. So I can see that pain med coming in for room 101. It tells me the duration that request has been going. If I simply touch on that, I can get more information. So I know the patient, gender, age, and I have the ability to call back to that room if I wish. I can go ahead and accept that. I'm on my way. Or maybe in this case, I'm tied up with another patient and I cannot respond immediately to this request. So I'd rather go ahead and reject that. And what I'm going to do is send that to another SpectraLink device. So I'm going to go ahead and reject that notification, and that's going to go out. It's going to show that has been rejected, and it's going to immediately send that to another device. And this is going to help with the overall escalation of that call and help get that patient response quicker, sooner than later, right? So I want to make sure that somebody's responding immediately to that notification. So I have that notification that's going out, and then what's going to happen is, however they decide to cancel it today within the existing nurse call. So maybe they have to walk in and push a button to cancel it, or maybe they walk in with the real-time locating system and they have a badge that they're wearing, a wearable, as I'm doing here. So as soon as I go into the room, I can see that April has entered this room, and that workflow is no longer present on the system. So I have now satisfied that request. And everything that was done is all being documented. So I know when the call was placed, I know what room and what patient. I have the contextual data once I respond to that request and find out that patient need, and I send that out. I know how long the operator communicated with that patient. Are they having a meaningful conversation in order to address that patient need? What was sent, who was sent to, did they accept or reject, how many times it escalated, and then when was it satisfied, and if we're leveraging a real-time locating system, who went in there and how long they were with that patient. So it's a lot of very important information that we're monitoring and keeping track of with this application. So this particular command center here, it could be on-prem, it could be on the unit. So if you had an existing Rauland system and you had that console that's sitting at the nurse station there, this console could be right next to it, because that system is still UL 1069. We're not going to replace that console with ours as primary notification, but they can, move it out of the way and they can put this in front of it, and now you can utilize this display that you see here to triage and answer all the calls at the unit level, or at a centralized location on-prem or off-prem. So if we think of a multi-tenant or multi-facility organization where I have more than one hospital with more than one different nurse call hardware platform, I can then bring in all of that to this call center. So it's up to the client to determine how they want to operate. Because this could be just a single unit that we come in and overlay, or it could be at the facility level or at the enterprise level that we can come in and overlay the software on the existing hardware and utilize a triage model where we can communicate with that patient and assess that need. And some of the more recent discussions we've had with potential clients with this offering has been at the multi-tenant centralized capacity rather than at the individual unit or even individual facility. So there's definitely a lot of interest with a multi-tenant platform, and because they get to standardize. And we're the only vendor that can offer this with the ability to utilize our overlay and call back to any nurse call system. And we do that via SIP, so it's a SIP callback, so we will leverage the hospital's PBX to give us extensions to those existing nurse call devices so that way we can basically dial back to each one of those rooms on any of those nurse call systems that they have.